This is an Eyewitness News special presentation. Holiday Alert, Omicron Surge.
New York is in a very interesting situation. You probably have a much higher percentage of Omicron already.
Tonight, we go one-on-one with Dr. Anthony Fauci as coronavirus cases explode once again in the tri-state.
Omicron is increasing rapidly, and we expect it to become the dominant strain in the United States, as it has in other countries in the coming weeks.
So what about the holidays, Christmas and New Year's? So many people traveling, so many visiting family members.
So is it safe? Is it smart? Tonight, we're getting answers for you and the people you love.
The facts are, if you are vaccinated and boosted, you are really in a relatively safe zone.
And good evening once again, everyone. I'm Bill Ritter.
And I'm Sade Better-in-Law. In many ways, the end of 2021 feels a lot like 2020.
We're supposed to be heading into a new year, not an old one, but the hard truth is the number of coronavirus cases is exploding. Broadway shows and sporting events getting canceled. People are rushing to get testing, and there is not paranoia, just genuine fear out there.
Yeah, over the next half hour, we're going to be breaking down everything you need to know as the Omicron variant spreads and we head into the busy holiday season.
Is it safe to travel to your holiday destinations? And should you get a rapid test before seeing family?
And what about shopping inside malls or attending holiday parties in restaurants?
And then there are the kids and the schools. As cases rise, will classrooms go remote again when winter break ends? Some schools already doing that.
We will walk you through all of these questions and concerns. But first, our exclusive one-on-one with Dr. Anthony Fauci, who spoke with Eyewitness News anchor Liz Cho, who joins us from the newsroom. Liz?
Sade and Bill, Dr. Fauci stressed that while the dramatic jump in cases is a real cause for concern, the best way to protect yourself is to get vaccinated and get a booster shot. We started today's conversation with some very encouraging news about new studies out showing that our current regimen of vaccines work against Omicron and why at this point there is no need for a variant-specific booster.
Well, what it shows, first of all, that the unvaccinated are really quite vulnerable, Liz, to getting infected and getting into serious trouble. Vaccination with a 2-dose mRNA protects you, but the protection wanes. And we found in the study that when you give a booster, a third shot to an mRNA, you dramatically increase the level of protection, even against Omicron. So we feel that boosting with the currently used vaccine for people who've been vaccinated is going to reconstitute what was a diminution in protection as measured by the level of antibodies. So the good news is that if you get vaccinated, you're going to be generally protected at least against severe disease. There's going to be a lot of breakthrough infections, to be sure. So people should not be surprised or discouraged if you hear that there are breakthrough infections. But the critical issue is that vaccination, particularly if you get boosted, will go a long way to protect you from getting severely ill.
Obviously, this new information emphasizes the importance of not just being vaccinated, but getting boosted right away. Currently, there's an age group, 12 to 15-year-olds, many of whom have been vaccinated for more than 6 months now, but still are not authorized to receive a booster. Why is that? And when do you think that might change? Because I think there are a lot of parents out there who are really hoping to get their kids boosted before the holidays.
Yeah, that's being looked at really very carefully now. You know that the boosting for 16 to 17-year-old has now been approved. But the idea of going lower than that, this is something we're paying very close attention to. It really is a matter of safety to make sure that a boost in the younger age group, particularly when you're dealing with things like the possibility of the rare effect of myocarditis with the mRNA. So the FDA and the CDC are looking very carefully at that. I think there likely will be movement in that direction within a reasonable period of time.
Obviously, there was some slightly disappointing news this afternoon. There was a study out about vaccines for kids to 2 to 4-year-olds. When do you think parents who have really young kids can hope to see a vaccine for youngest children?
You know, that's a good question that I don't have a precise answer for you, because the study that came out from Pfizer showed that they did not get the response that they wanted in that group, and they're going to likely add an additional dose to make it a 3-dose vaccine. The data that will come from that likely will take a couple of months. So I don't think we're going to be seeing vaccines for the children of that age group, at least for a couple of months, at least, maybe longer.
Maybe longer even.
Yeah,
okay.
right.
Here in New York City, we have seen the positivity rate double in 3 days. Many officials here have gone on record saying how alarming that is, that we've never seen this before. Mayor de Blasio insisted today that he does not believe we need to start closing schools or businesses, but we have seen Broadway shows temporarily shut down. Today, the Radio City Rockettes announced that they are canceling shows today because of breakthrough cases. Considering we're in a Delta surge and on the cusp of an Omicron surge, is now the time the city to reconsider holding large-scale events like we're going to have here in Times Square for New Year's Eve?
Well, I think the local authorities, and I know the New York City authorities are very careful and sensitive about that, are really going to evaluate it in real time. Right now, I think what you've seen in New York City is organizations like some of the Broadway shows and the Rockettes and others trying to be careful and prudent. So I think that's something that in some respects we should pay attention to. And they may be doing the right thing. But as far as complete shutdown, I don't really see that in the future. But I just think we should literally on a week by week basis monitor where we're going. You're right. New York is in a very interesting situation. You probably have a much higher percentage of Omicron already than many locations in the rest of the country.
I want to talk to you a little bit about the holidays. You have said that if you are vaccinated, you should feel comfortable seeing family. Considering this uptick that we are seeing in positivity and hospitalizations and unfortunately deaths as well, are you still comfortable with that?
Yes, and I'm going to do that myself. I mean, I'm vaccinated. My wife is vaccinated. We're both boosted. My children who are going to be coming in, flying and driving from different parts of the country, all are vaccinated and boosted. And no, the risk is not zero, Liz, but I believe that it is so low that we're not going to deprive ourselves for yet another Christmas not being together. Last year, we were apart because there was no vaccine. And I think it was prudent not to gather together. But this year, all of us being vaccinated and boosted, I think it's safe enough that we're going to do it.
What about travel? So many people are planning to travel in the next week or so. You know, we're supposed to see pre-pandemic numbers for travel. And while, like you said, this isn't March of 2020, we have vaccinations, we have boosters now, but there's still a good deal of anxiety about that, about what to do.
You know, people are going to have to make their own choice based upon the level of risk that they're willing to take. So what you need to do is get them the facts. And as we said, the facts are if you are vaccinated and boosted, you are really in a relatively safe zone, not a completely risk-free zone, but relatively safe. Travel always increases the risk of spread because people congregate at airports. You're in an indoor setting. If you're going to travel or you have to travel for family reasons, be careful. When you're in an airport, make sure you keep your mask on.
Well, I also talked to Dr. Fauci today about testing because we have seen those long lines here in New York City once again. Dr. Fauci said that he does not believe that we will see a shortage of tests during this surge because the federal government has pledged to make between 200 and 500 million tests available per month. And he said while the chances of ending up in the hospital remains low for people who have been vaccinated and who have been boosted, as more unvaccinated go to the hospital in the next few weeks and months, that could put a huge stress on hospitals around the country. And that is something that he is very worried about. Bill and Sade.
A real domino effect there, Liz. Thanks. Really interesting interview. You heard Liz and Dr. Fauci say it. Traveling and testing. You're going to hear those two words a lot over the next week or so.
More than 109 million Americans are expected to travel for the holidays. That's 3 times as many as last year. And the airline industry is seeing a 184% jump from last Christmas.
But maybe some people, or many people, who knows, will change their minds, depending on whether they get a positive or negative COVID test. And what kind should you get? Wait in those long lines for a test, or maybe try and get your hands on a home testing kit?
Eyewitness News reporter Jim Dolan is live on the Upper West Side with that part of our coverage. Jim?
Yeah, Sade, you're seeing it all over the city again, right? These long lines of folks getting tested for COVID. A lot of them are hoping to travel for the holidays, and they just want to do it safely. But a lot of these people have also had contact with someone who recently tested positive, and you can imagine how worried they are about that as this late autumn COVID surge rages on. In Harlem today, if you wanted a test for COVID, and lots of people did, you had to settle in.
I've been in line for 3 hours.
You have too many people standing in this line for you to just have one little bus. They need 2 buses.
Well, that's what they did on the Upper West Side, though it didn't seem to do much good there. To see the long COVID testing line on Broadway that winds its way north and then east, it seems about halfway to the end of the earth, you got to move fast. And among all those people, masked and double masked, Omicron is about all anyone is talking about.
It's like wildfire, baby, and I just want to be safe.
It's like wildfire. The Omicron variant is reshaping the COVID landscape with its warp speed spread just as the holiday travel season starts. Shannon is getting tested so she can go to Scotland because you know who's there?
My whole family.
She hasn't seen them in more than a year. Rebecca is just hoping to go to Maryland with her husband and 2-month-old baby, but even that trip is scary.
It seems like Omicron is really growing, and we're hearing a lot of breakthrough cases. My husband and I are both vaccinated. I got my booster yesterday, but we're still a little bit nervous, seeing older family members.
And also with the babies.
Yes, also with the baby.
It's like this all over the city as Omicron looms and the holidays approach, with folks waiting on the Upper West Side.
You want to get your test, make sure you come an hour ahead of time.
The city promised to hand out home testing kits to anyone waiting more than an hour, but no one was offering those here. And in Harlem at the Health and Hospitals testing site, they ran out of free testing kits by mid-afternoon. In fact, they were tough to find even if you wanted to pay for them. Most pharmacies were out.
I have been in one line for about 35 minutes to get scanned, and then I got this barcode, and I've been in this line for a half an hour.
In Midtown at a private testing facility, the line wasn't much shorter. Sophie has spent a lot of time in it, hoping to finally get to see her family.
Well, I've tested negative 3 times already this week, and I'm hoping I'm still negative, but I'm not supposed to fly out until next week. But I'd like to leave here sooner if I can.
There are plenty of reasons to get tested. Sophie just wants to get on a plane. If you are negative today,
Probably booking a flight tomorrow or Sunday.
it is for all of them a scary time.
I know a few people that tested positive, so I was likely exposed, and I just want to be careful.
It is so scary. This testing site here on the Upper West Side is scheduled to close in 20 minutes, but the line is still long. They have a long way to go, and the site will be open again tomorrow. Reporting live from the Upper West Side, Jim Dolan, Channel 7 Eyewitness News.
Scary and uncertain times indeed. Jim, thank you. We are just getting started on this Eyewitness News special presentation. Coming up next, will schools be forced to shut down as cases rise? Tonight, New York Mayor de Blasio weighs in as we have new guidance from the CDC. And from indoor shopping to indoor dining, we'll tell you how to stay safe at a time when so many of us are out and about. And before we go to break, a look at the states where the Omicron variant is currently spreading, and again, with cases doubling every 2 to 4 days. The variant will soon be the dominant bit of COVID across the entire nation. Now back to the pandemic and the new CDC guideline about schools as coronavirus cases rise in New York and indeed across our area and across the country.
The CDC adopting a so-called test to stay policy, saying unvaccinated students exposed to COVID no longer need to miss school if they repeatedly test negative.
And when asked if New York City schools will shut down because of Omicron, Mayor de Blasio responded with 3 words: no, no, no.
But what about suburban schools? Stacey Sager's live outside of an elementary school in Elmont that went back to remote. Stacey?
Well, Sade, this elementary school was so short-staffed because of COVID. They did have to close their doors this week to students. And across Long Island, it really varies from district to district. 450 different school buildings, the vast majority of them not going remote at this point, but all of them uncertain about what the future may hold.
Spending time with their parents here in Elmont today, but how much will be too much for the working parents of students here at Clara Carlson Elementary School, where the classrooms and playgrounds are empty once again. 4th grader Andre now all remote after 7 COVID cases in his class alone.
I don't really like it, and I don't want to get the COVID.
Making sure he's okay, missing work. It's just crazy.
And in other schools like Division Avenue High School here in Levittown and at East Rockaway High School, there has also now been a shift to remote learning. Administrators citing the outbreak of COVID cases just too rapid to keep up. Hundreds between all three districts now forced to quarantine. But from the CDC today, new guidance, what they're calling test to stay. That is, science showing that unvaccinated kids may be exposed to the virus may not have to stay home anymore if they keep testing negative.
And that testing needs to be at least twice during the 7-day period after exposure.
Of course, you have to find a testing center that will take you, and given Omicron, the lines are now shutting some people out. Meanwhile, other districts like Jericho, more optimistic, hanging on with fewer cases. But they are picking up 6 cases here yesterday. But they don't plan on shifting to remote learning, at least not now.
The question is, what's our level of concern on January the 3rd? Obviously, we'll monitor over vacation. We'll continue to monitor, and we'll monitor the first week we're back.
As parents across Long Island wonder which school buildings will go dark and how much their lives will change again.
I actually just went back to work. I was a stay-at-home mom the first time around, so we'll see how it goes.
They'll see how it goes. And a lot of those parents telling us this really does start to feel like whiplash after last year. But 2 big factors, staff shortages and also severity of illness. So these are 2 things that school administrators will certainly be keeping in mind throughout the holiday break. As for this school, parents got word late today it will remain closed to students. They'll be on remote learning through next week until the break. We're live in Elmont. I'm Stacey Sager, Channel 7 Eyewitness News.
Complicated indeed, Stacey. Thank you. Coming up next on our special, to dine out or not to dine out.
I'm Lauren Glassberg at a Tudor City restaurant where 45 reservations were canceled in just one day, the result of fears over a COVID uptick. The story coming up.
Look at this image. This is a worldwide problem. This is a mall in South Africa putting up a plastic shield to separate kids from Santa after the Omicron variant spread through that nation.
And as we take a live look from Newscopter 7 at the Garden State Plaza in Paramus, so many people will be at the mall this weekend finishing their holiday shopping. And doctors say you must wear masks inside and try, when possible, to avoid large crowded areas.
It is usually the season for shopping and holiday parties, usually big business for stores and restaurants, but not this year again.
As Eyewitness News reporter Lauren Glassberg found out, Omicron is closing restaurants and wiping out large group reservations.
The padlocks are in place at Contento, a Peruvian restaurant in East Harlem. Owner Yannick Benjamin taking precautions after a customer and staff member tested positive for COVID.
This was going to be our biggest week, and here we are. We have to shut down.
He temporarily closed his restaurant on Tuesday, just minutes before serving a private meal to 25 guests. He's particularly conscientious because some of his staff members are immune compromised, and his restaurant caters to people with disabilities.
I feel like as a restaurant that practices and believes in social sustainability, just to say it is not enough. You have to act upon it, and that's certainly what we did.
And other restaurants are facing similar issues, posting on social media that service is on hold because of COVID cases.
We hope to see you soon again.
The Omicron variant wiping out reservations, particularly for larger parties at Tudor City Steakhouse.
The last 10 days, we have around 300 people cancel altogether. They're scared, you know.
As for Contento, it only opened in June, and just this week it was named one of the New York Times 10 best new restaurants. Closing doesn't help that momentum, but it's the prudent thing to do.
I find going to bed a lot easier and closing my eyes and knowing that people's lives are safe and that we are, as an entity, as Contento and what we believe in, we're doing the right thing.
And while restaurants are required to check for proof of vaccination for indoor diners ages 5 and up, restaurants are also contending with breakthrough COVID cases and a highly contagious new strain. The challenges keep coming for restaurants. In Tudor City, Lauren Glassberg, Channel 7 Eyewitness News.
Challenges for so many businesses. Well, that will do it for this Eyewitness News special presentation. And you can watch our entire exclusive one-on-one with Dr. Anthony Fauci at ABC7NY. That is where you can also find all of the latest headlines on the Omicron variant and the various state and city mandates.
To be sure, we are living again in rather uncertain times, scary times. We are here to bring you facts and the truth no matter where it falls. The numbers don't lie. So let's be smart, let's be safe, and perhaps more than ever, let's take care of each other.